So Rads, you're well experienced in delivering critical healthcare systems. The digital user experience is key, right?
Yeah, absolutely, Paul. In the UK, healthcare remains one of the biggest employers. We know NHS is one of the biggest employers in the world. And there's enough evidence to show that staff satisfaction has a direct impact on patient outcomes. And a big proportion of that staff experience really relates to the digital experience of the staff member. So you could have a very well-designed clinical system, whether it be nationally deployed or locally deployed, but really if the device that the staff member is using is not optimized for that user experience, it really doesn't have the desired impact and the benefit that you desire, and then the benefit that the patient could have from that clinical journey.
And this plays into retention, right? And we've seen real challenges in the workforce over recent years, so a great digital experience is going to help mitigate the risks around that challenge.
So Paul, when we now think about a patient's end-to-end journey, every little part has been digitized to a certain extent, hasn't it? How does Workspace play a part in this?
Yeah, exactly, Rad. So there's been billions of pounds invested in the digital transformation of healthcare and the NHS over recent years, and that's only going to continue. We're seeing 9 out of 10 providers with an electronic patient record. So right through that pathway, right through that patient journey, there's digitisation from the first patient contact through the booking, the administration, the consultation and the follow-up. And any issues with the technology throughout that journey is going to disrupt both clinical schedules but also the patient experience. And ultimately it's bringing this back to quality and safety.
Yeah, absolutely.
So Rads, the way people work now in the NHS and healthcare has completely changed. What's your take on that?
Like many sectors, you are seeing a shift towards more hybrid working patterns in the NHS. But of course, a lot of care that's delivered in the NHS remains frontline. But there is a lot of focus on flexible working. So from a digital workspace, it's really enabling staff being able to work from anywhere that they require to work from. So really enabling staff, whether they're providing care from bedside or from a community centre, for example. Of course, with this comes the challenge of security. So you really have to think about having the right security tools to support your work staff, but also balancing the act when it comes to devices, because the devices are doing a lot of heavy lifting right now in healthcare, right from the booking processes, administrative processes, to very, very complicated clinical tasks. And it really is about helping the staff being able to use some legacy systems that still are being used in the NHS, whilst really using some very modern systems that are being introduced.
That's great, Rads. And the NHS is working in a much more collaborative way now, isn't it, with multidisciplinary working?
And that's a positive shift where digital has an extremely important role to play, because you could really have such effective collaboration and communication using the right digital technology tools deployed on the right devices.
And secure and all that, getting the balance of security and productivity, it's really important, isn't it, that there's an integration across those technologies from the device security right through the security stack.
Yeah, absolutely.
So Rads, improving access is a key focus in healthcare and the NHS. How does digital workspace enable that to happen?
We know that you can enable staff in much better ways than we currently do, through better provision of devices, through better technologies on their devices to be able to find the information that they need. We know that a typical staff member, when they're trying to book a patient journey, is having to find different pieces of information to enable that to happen, whereas through digital workspace, we can make that much more easier and streamlined. We also know that there's an increased demand for self-service, and we know that there's a lot of increase also in virtual care that's happening. And again, through better use of devices and technologies that can be provisioned in the best possible way. There's a lot around AI-powered call centers that we are seeing in other industry sectors, which can be used in healthcare, giving more and more options to patients through their digital journey, so that they can use different channels as appropriate.
So it's all about right care, right place, right time, and digital workspace can help to make that a possibility.